The work was also very rewarding because the other side of it is that you're able to see how people can recover and the factors that contribute to people being able to recover. You get a chance to see that as well.
Before I take a break, let me just go to the chat room. Patrick said,
Sure.
Pomeroon, yay. I guess Patrick
All
is
right,
from...
Pomeroon.
And Patrick said again, good evening to you and your beautiful guest. Great conversation.
Oh, thank you.
I want to leave you with this question before we go on the break.
Okay.
For those people in their 40s and early 50s who are married,
Yes.
some with children, have a successful career but are feeling sorry for themselves and in a sort of what's next mode, how would you advise them to find happiness and fulfillment? Is that a fair question?
Sure.
I'll repeat it when we return.
Okay.
All right.
Okay.
We are back with Dr. Caldeira. Would you like me to repeat the question?
Yes.
It's only fair, right?
Yes.
For those
thank
people
you.
in their 40s and early 50s who are married, some with children, have a successful career, but are feeling sorry for themselves and in a sort of what's next mode,
Right.
how would you advise them to find happiness and fulfillment?
Okay. Oh, great question. So we are lucky. We're at a time when we're actually in a stage in the science where we now know how to increase happiness, right? For a long time, psychology, psychiatry, the field was focused on the disease model, right? So looking at, abnormal behavior, looking at why things go wrong, what's wrong. And one of the things that happened is that there was so much focus on this model that we forgot, or there was less emphasis to do research, talk about resilience, talk about, well, when things are going well, how do we enhance those things? How do we take those things that we're learning from when people are coping well? People have great, effective coping mechanisms. How can we share that with the whole community? So in terms of happiness and increasing happiness, what we now know is that, there are three components to increasing happiness. One is increasing the amount of pleasure you get. Another is increasing your engagement. So the idea here is that you have a way of finding out what your strength is and really engaging that strength in your love relationships, in your work, so that you have now this engagement, and that helps to increase your level of happiness. And the last one is, the ability to find meaning in life. So using that strength to give back. And so those are three components that we know how to increase happiness.
Can you repeat the first one, please?
So the first one is just sheer pleasure, engaging in pleasurable activities. That alone will not, in general, increase your happiness. It will increase the amount of pleasure you feel in the moment, but that factor alone will not increase your, overall sense of happiness. Along with the other two factors, that enhances your level of happiness.
What about people who, and someone asked me this question today.
Yes.
We're talking about people who self-sabotage. They're in a happy space, happy moment, but somehow they find a way to find all sorts of flaws and problems and act it out in what's going on. What causes that? Well, what are some of the things that might cause something like that?
Right. So it might be that they've had some negative experiences in the past, maybe a traumatic event, but not always. Maybe they were criticized a lot, and so they end up criticizing themselves. And so, it would be helpful for that person to meet with a licensed professional and talk about, what's the pattern here? Kind of list out the ways in which they're putting obstacles in their own path, or they're finding that they're encountering a similar obstacle again and again and again. So that would be a way to start looking at that. And then there are ways in which you can address this issue. Once you're able to identify the pattern, then you can look at the way you think. One of the things that I work with is helping people develop a healthier way of thinking, and also helping people make that connection with maybe you're not making the connection between something that happened in your past that is still impacting you now.
For couples who are experiencing passivity in the bedroom, how would you advise them to get reacquainted without it seeming like a chore or too much work? Yeah.
So without seeming like a chore or too much work.
Yeah.
So one of the things I think that, we tend to not practice enough is really just the idea of talking about sex openly with each other, and the intimacy in the act or the activity of really communicating about sex and other forms of intimacy like touching, etc., is a way to reconnect, and then that will help you feel more intimate with your partner and lead to better action in the bedroom.
Let us talk about, or tell us about, let's talk psychological wellness, PC, and the trigger that encouraged you to start it. What is that about?
So it's a little bit about what I talked about earlier, in the sense that my training was very much focused on the disease model, as I said before, and what I really want to integrate is, what we talk about as positive psychology. So a focus on finding your strengths and using those to increase your health and well-being. So that's the idea of
finding your strengths.
Yes.
And using those to increase your health and well-being.
Yes.
I love that. What appeals to you about clinical psychology?
Well, the ability to work with others, to, engage with others and with helping them with the problems they present. So helping them to recognize some patterns that may not be helping them
Right.
reach their goals. And what excites me about the field is that, again, I was involved for many years on research teams, and so just seeing the developments that are happening that we can bring from the research lab into the clinical room, that's something that continues to excite me about the field.
Here is what really intrigues me. You treating soldiers that
Yes.
return from Afghanistan and Iraq and so on.
Mm-hmm.
What surprised you the most about those experiences?
That, I guess the most surprising thing was that these are not killing machines, right? That my experience, I worked for about a year on an Army base, an Army base hospital, and one of the things that surprised me the most was that soldiers had the same difficulties with being vulnerable as
Yes.
everybody else. It was a unique experience in the sense that, of course, when you think about it, the people who I and other psychologists had contact with were the people who were in trouble. So we weren't often really talking to the people who were not really having a lot of difficulty. And the people who were having trouble, oftentimes they were in crisis. So for the first 6 months of that job, I was actually, the on-call psychologist. And what that meant is that every time somebody expressed suicidal thoughts or homicidal thoughts, they were brought to the ER, and the on-call psychologist's job was to evaluate that person, whether or not they were safe enough to be back in the community, or whether they needed to be hospitalized, or whether they needed 24-hour watch.
Compare that to assessing veterans for post-traumatic syndrome. Symptoms, sorry.
Well, in a way, it wasn't that different because, a lot of the times the soldiers I was working with at the Army base, the veterans that I evaluated, I was sort of assessing similar things. So I was evaluating, what kinds of difficulties they were having at the moment, what kind of symptoms they were experiencing. Are they experiencing symptoms that are related to traumas they've experienced? And so the only difference with the veterans from the Vietnam War that I evaluated and the soldiers who were returning from combat is the time from the event. So the soldiers that I worked with on the Army base, were months from what they had just experienced, whereas the Vietnam vets,
Right.
they were, years and years from that experience.
Tell us about your mentor. So
Yes.
tell us about your experience with mentorship and why did you become a mentor?
Well, I was a beneficiary, I believe, of excellent mentorship. I would say ever since I was, a young girl in kindergarten, I remember clearly my teacher, Miss Suknandan. I remember her name. I remember what she looked like, giving my parents feedback about me, and I remember the experience of confidence it gave me in what I was doing. And over the years, I feel that a lot of those experiences are things that I want to continue, that people in my life who were mostly my teachers did that for me, and I feel obligated to return that.
What advice would you give to young people who want to pursue a career in clinical psychology?
Get out there and volunteer.
How important is
find a place where you think you might connect and volunteer.
Is that very important, volunteering?
Very important, very important. That volunteer experience with those children, I still remember being able to sit with them and help them read. I also volunteered at the Brooklyn Women's Anti-Rape Exchange at Long Island University. And remember feeling very rewarded being able to help people who had just been experienced, violence, very personal violence, rape, or other sexual assault. That those experiences really taught me not just about helping, but help me to be clear about what I want to do and how I want to give back.
Do you find, and it's a question I've been dying to ask a psychologist.
Yes.
Do you find that men and women cope differently with traumatic experiences?
I would say yes and no.
Yes.
Right?
And no.
No, in the sense that all of us, right, when we have a traumatic event occur, something that threatens our lives or is something that's either threatens our life or is a serious injury, or we witness a dangerous event, most of us will experience similar symptoms. So generally what happens when you have this kind of experience is that your body goes into what we call the fight or flight mode, right? Which is very normal. We prepare ourselves for danger, and we try to, the body is responding biologically in a normal way. What happens after the event is that most of us will have maybe some bad dreams about the event. We might have some flashbacks thinking that the event is still happening. That's very normal. What happens when it's a more serious, becomes a more serious problem is that if a month later we're still experiencing these symptoms and they continue to affect our work, our relationships. And in terms of, the difference between how men and women might cope, it would depend on past experiences, but we know that we are socialized differently as well. And so, for men, oftentimes, and I saw this in the Army, they express a lot of difficulty with managing anger, for example, whereas women would also experience that anger, but would internalize a lot of shame about the event, so it's more internal. So that's one way, but in some ways, everyone who develops a more difficult time coping experiences the same shame, experiences the same difficulty managing anger or other emotions, experiences the same difficulties trusting others, the same difficulties connecting with others.
Patrick, in the chat room, Patrick asked, how does your dealing with other people's traumatic issues affect you? How do you stay healthy?
How do I stay healthy? Oh, I love that question. So one of the things, the basics, right? You want to make sure that the basics are in place. So sleep is very important. We have so much information now about how to get good sleep
Is that
and
so?
how important sleep is to reducing stress and to buffering us against stress. So sleeping well, eating well, moving. But another thing that I do frequently, because I don't get a chance often, other than when I'm walking, to exercise as much as I would like. One thing I practice almost every day, or at least when I'm working 5 days a week, is 10 minutes of meditation.
You meditate?
So I practice listening to a guided meditation, and it is a powerful stress reliever. So that's how I take care of myself, and also maintaining my connections with others, with my family. Your social network and how strong that social network is a powerful protector in terms of how you cope with any stressful event that arises.
I have a similar question.
Sure.
Before we take this break, you help others to recalibrate, sort of discharge and recharge. Who helps you?
Well, I would say my family, definitely, and my friends. My network of friends help to recharge me, definitely. And I enjoy reading a lot of books as well. Reading I enjoy mostly reading biographies and autobiographies. That really keeps me inspired and energetic and, keep me thinking. Yeah.
Let's take a quick break.
Sure.